right. Hello, everyone, and welcome to what we hope will be the first of many lunchtime PPHA educational sessions this year. Today, we have with us the Executive Director of Pennie, Zachary Sherman, along with Scott and Juan, to tell us more about Pennsylvania's new health insurance marketplace. Today's session will be recorded, so you'll be able to view it on our website afterwards. As we go through the presentation, please post any questions you have in the chat, and I'll be moderating a brief Q&A at the end. Without further ado, I'll go ahead and turn the presentation over to Pennie.
Thanks, Brooke, and thanks for the opportunity to be here today. I didn't realize this was the first one, so I hope it's not disappointing because we should get this off on the right foot, right? But thanks for the opportunity again to be here. As you mentioned, I'm Zach Sherman. I'm the Executive Director of Pennie, which is Pennsylvania's new health insurance marketplace. And we're happy to be here to tell you a little bit about what that means, who we are, what we do, how we help connect Pennsylvanians to coverage. So with that, I'll start at the beginning in the not so distant past. With a little bit about how we came to be. Pennie is the result, the culmination of bipartisan legislation that passed both chambers of the General Assembly in 2019 unanimously and was signed into law by Governor Wolf in July of 2019. The legislation created a couple things in the interest of expanding access and driving affordability in the individual market. The legislation created Pennie, Pennsylvania's new state-based marketplace, to replace healthcare.gov, the federal marketplace. The idea was to take local control of marketplace operations, to be more accessible, to help Pennsylvanians navigate the marketplace shopping process, and to be a lot more efficient than the federal marketplace, which Pennsylvanians were spending nearly $100 million on for use of it. The idea here was to drive a lot more value and do it for a much better price tag. The second program that was created by the legislation was an affordability program called reinsurance, which effectively reduces the cost of insurance in the individual market from what it would have been had we stayed on healthcare.gov, and was funded, intended to be funded by the savings garnered from running Pennie, a state-based marketplace, more efficiently and more affordably. These two things, the kicker really there was that they work hand in hand and they cost no additional money, that they were fully funded by what we were previously paying for use of healthcare.gov. So that was enacted, passed in 2019, and fast forward to last fall, Pennie opens its doors for the first time with the goal of improving the accessibility and affordability of individual market health coverage for Pennsylvanians. On November 1 of last year, we opened our doors, open enrollment began, and we became the official health insurance marketplace for Pennsylvania. What that meant is that we had replaced healthcare.gov, including for the 290,000 Pennsylvanians who were enrolled in 2020 through healthcare.gov. We efficiently moved them over to Pennie, to the Pennie program, allowing them the opportunity to renew into coverage or shop around for 2021 coverage, whichever they preferred. So we've replaced healthcare.gov. It's important to note that even if you go to healthcare.gov today, as soon as you type in your zip code, they redirect you back to Pennie. They send you back to us. Same thing goes for if you give them a call, they'll make sure that you get to the right place. So even if previously you had gone to healthcare.gov or you're just not sure and you end up there, we've replaced them and we've coordinated it with the federal government so people get to the right place to get their individual market health coverage. We are the home for high quality, affordable health insurance plans, and very importantly, the financial assistance to reduce the cost of coverage and care. Nearly 9 out of 10 of our customers receive some form of financial assistance, and for most of them, it's really the difference between being able to afford it and not. The financial assistance is significant. Those that receive it get about $515 in savings on average every month. We exist to serve families, individuals who don't have access to coverage through some other means. So obviously the uninsured looking for an affordable, quality health coverage option, but also working families who don't have um, coverage through their employer and make too much money to be eligible for medical assistance or CHIP through the Department of Human Services. We're really in that spot where there is no other affordable, comprehensive option. We come in with those options as well as the financial assistance to help pay for it. And in addition, we work very closely as a result of being a state entity. We have partnerships with the Department of Human Services to ensure that anyone who comes to us who's eligible for Medicaid, medical assistance, or CHIP has, even if they apply through us, they have an easy pathway over to the right place to ultimately get covered through those programs. And likewise, anyone who goes to the Department of Human Services and applies for coverage, but is eligible for our program, there's a pathway for that customer to get over to us and ultimately get covered through Pennie as well. We aim to help in whatever way is most comfortable for our customers. We know, particularly when you don't have support from an employer or some other organization, we know the process of purchasing and enrolling in coverage can be overwhelming. It can be confusing. Finding the right plan for your family's health needs and your budget is a really important and a really personal decision. And getting that right can be overwhelming, like I said. And in recognition of that, we have a number of services that are available at no cost to our customers to allow them to navigate the process and get the assistance they need. So we have a dedicated call center, which is available for customers to call in and ask questions or to call in and get assistance all the way through the application and enrollment process. We have a number of online self-service tools that allow people to filter and sort and tell us what's most important to them about the plan offerings to give them a whittled down version of plans or a prioritized listing of the plans. And Juan will go into more detail about that process. And lastly, in addition, we have partnerships with health centers, nonprofits, as well as licensed insurance professionals, insurance brokers, to provide tailored one-on-one service. The health centers and nonprofits are known as the sisters. You can get an appointment with them through our website or by giving us a call, and they will provide in-person or virtual one-on-one assistance through the application and enrollment process. Likewise with the insurance brokers, you can get appointments through us with them. They're trained and certified. They're also legally allowed to give advice on the right plans. So if you're looking for a little bit of assistance, but also expertise on the right plan for your health needs and your budget, a broker can provide that assistance as well. And all these services are really at no cost to the customer. So a big and important question is, when can I get enrolled through Pennie? When is the time to enroll in coverage? And in normal times, that time period is primarily through our annual open enrollment period, which is listed on the middle of the slide here. That runs every year from November 1 through January 15th. And it is specific to the plan year, the upcoming plan year. Unless you experience some sort of special qualifying life event, that's the time where you can enroll through Pennie. On the qualifying life event front, if you experience one of those, and examples include losing your employer-based coverage, or having a household change, having a kid, getting married, or moving to the state, or moving from one part of the state to another, those are all triggering events that give you a 60-day special enrollment period outside of open enrollment to enroll in coverage through Pennie. Those are normally the standard times that you can enroll through Pennie, but in recognition of the public health and economic impacts of the pandemic of COVID-19, we have a special window of time right now. It started on February 15th. It runs through May 15th, where anyone who's otherwise eligible can enroll in coverage. We're specifically targeting those that are uninsured, newly uninsured, have been uninsured, and are looking for an affordable health coverage option. But it's really open to everybody who's otherwise eligible. And now is the time to come in and take advantage of that opportunity. This slide gives you an overview of two things. On the left side is the full list of the qualifying life events that trigger a special enrollment period. I won't go through them in detail. We will share this deck with you, and you can review that at your convenience. On the right side of the slide is a little bit more about the COVID-19 enrollment period. Again, it runs from right now all the way through May 15th. It's important to note and clarify that this is really for everyone who's otherwise eligible. The pandemic has directly or indirectly impacted all of us. And in recognition of that fact, this enrollment period is available to everyone. Like I mentioned, we're targeting the uninsured, but current customers can evaluate their options and switch plans if they want to. They can also add uninsured or family members who are looking for coverage to their plans as well. And then lastly, and Juan will get into this, but the steps to enrolling through this enrollment period are listed at the bottom of this slide. So who are we talking about when we reference the uninsured? This slide gives you an overview of where the uninsured live across the Commonwealth. This is based on 2018 US Census data. And while it doesn't have any current impacts of the pandemic, we do think it is illustrative of where people who are uninsured live across the Commonwealth. The darker the green the county, the larger the number of people who are uninsured live in it. And as you can tell, the uninsured are, there's where we have higher population centers, there's a higher number of uninsured. So Philadelphia County is the county with the largest number of uninsured, but there's a good amount in Lancaster County and Allegheny County and other pockets across the Commonwealth. We also, a little bit more about the uninsured. They tend to be younger. They tend to skew male. They tend to skew lower income, and there are a disproportionate amount of uninsured in the Latinx populations as well as the African American population. And I will just add that, related to the uninsured skewing lower income, this means, and we know that there are a large number of uninsured still out there that are eligible for the financial assistance that we offer to reduce the cost of coverage, and in some cases for $0 or zero cost health insurance through the medical assistance or CHIP program. So this is really an opportunity to, in our mind, to share more information about these programs to ensure we're getting the information, the education out there about the availability of low cost or even no cost health coverage available through these programs. So now I'm going to hand it over to Juan Valencia, who's going to go into a little more detail about the customer experience, as well as how different types of customer scenarios play out. Juan? Juan, you're on mute.
Thank you so much. Thank you, Director Sherman, and thank you to the Public Health Management Corporation for this important invitation. And it's true, we're talking about the uninsured population. I used to live in Philadelphia for 20 years. It's an extremely diverse community, and that's why we are very excited to have this opportunity to talk to you guys about it. With one of the main reasons of Pennie, why we are so eager to communicate, is because we really provide financial assistance. This can make difference to make people to have access to health insurance and make it more affordable. And who do we help? Who is eligible to get a Pennie insurance and financial assistance? Would be citizens or residents, anyone that is lawfully present in the United States. So we're talking about everyone that has a green card, a visa, is here for special permits. So all of residents in Pennsylvania, and you must live also in Pennsylvania to be able to have access to Pennie. We are the only source of financial assistance, and we do this through a credit, a tax credit steps that we have. And 9 out of 10 people that work with us, 9 out of 10 receive financial assistance. In addition, if you are not eligible for financial assistance, you still receive, as the doctor was mentioning at the beginning, we have the reinsurance program, and that allows the entire rates to get lower in about 4%. So there are benefits in that. And just to give some numbers, so we are more clear, we benefit more, $12,800 and $51,000 if it's an individual, or if it's a family of 4, they are making less than $106,000, will benefit greatly from the financial assistance that Pennie provides. If you go to the next one, please. Okay, it's important again, we offer in Pennie health medical assistance, but we also offer dental plans. And one important thing is we offer good quality plans. They all meet the requirements of the 10 essential health benefits. So this is important because it's in line to the Affordable Care Act. Every plan that we sell at Pennie is a good quality and what we meant to be affordable. You can be denied coverage due to the pre-existing condition. And also individuals that are under 26 can remain on their parents' coverage. What we do in Pennie as exchange, right, is that we create a healthy competition where the principal insurance company, private insurance company in Pennsylvania, get together and under the umbrella of Pennie. When we create that space, that competition that lowers the rates, you can recognize big brands in the market. We'll talk about Capital Blue Cross, Geisinger, Highmark Blue Cross, Independence Blue Cross, Oscar, UPMC in medical part, but also in dental, we have large companies that you may recognize, like Dental Quest and other companies, Guardian as well. So that's important to know that we are not an insurance company, we are the exchange, but we offer that platform where people can come, can shop, and can receive financial assistance. The way that we help, or we offer help or assistance, I think the main part is our website. And our website is pennie.com. And here is an important, it's not pennie.gov. Even though we are a state agency, our research indicate that we want it to be very welcome to include everyone. And .com will provide that feeling a little bit more open. So we did create everything in pennie.com. It's a very approachable, easy to navigate website. We have different languages. We have in Spanish, we have in English, we have in Spanish, we have in Mandarin, and we have in Russian. And we did that specifically because we understand there are very large Asian and Russian communities in Philadelphia specifically as well. So we are aware of that. We create a ability for the website to be translated. And this website allow us to shop, literally look in our yellow button when you just click get cover. With pieces of information that are very simple, your estimated income, your age, and your zip code, you can check for yourself and you can see if you qualify. The beauty of this part is that we are not asking for any private information, phone number or your email. This is, you can come anonymously and look for different options in your dental plan and medical plans. We do have also a lot of resources in our website for partners, community organizations, and that want to spread the word about Pennie. And again, we are new, and this is part of what we're trying to create, facilitate resources. So we have a good toolkit of market materials in our website, and a lot of videos in Spanish as well, and English that you can share as well. The way that we help, 3 different layers as well. We have a customer call center. We have bilingual Spanish and English customer service representatives, and we also have a language access line that literally serves any other language that is out there. So our phone number is 1-800. It's 1-844-844-8040. We're going to see in the next slides as well, in case you want to take notes. But it's also in our website. And the other way that we offer help is through a network of certified and professional trained brokers and assisters. And we are glad that in this particular case, we are partnering in different locations in around Philadelphia, where we have assisters in some of your facilities and locations. And this is great because that allows us, in general, everyone, to have access to someone in these healthcare organizations and community organizations that can talk to the community, a social worker that is trained as an assister, and they can answer questions. We know a lot of the immigrant community is more likely to have a person relationship. Our call center is virtual, but through the network of our brokers and our assisters, people can have literally help person to person as well, or virtual or on the phone. So those are part of the resources that we offer. Again, our here's a phone number for everyone. It's 1-844-844-8040. We are open from 8 to 6 p.m. And especially now that Director Sherman was mentioning that we're open for business due the COVID-19 open enrollment. If we go to the next slide, Scott, thank you so much. The way that you can help, first of all, is to recommend pennie.com. That's extremely important, just to share, to spread the word about Pennie, not only to individuals, but also to groups. If you are connected with a group or organization, or you identify that someone will benefit about having this type of education session, please contact us. We'll be more than happy to accommodate and continue doing this outreach. stay informed. The way to be connected is through social media as well. We have Facebook and Twitter official accounts, and you can visit our Pennie website and share any marketing materials that you want. We are new, and we literally want to work more and better with you guys. You have a lot of experience in different types of communities. You may have ideas and suggestions and feedbacks. Any kind of suggestions that you may have, we are always welcome, easy to and very accessible. You can participate in our monthly outreach and education work group. Those meetings are every Wednesday, every first Wednesday of each month. And it's open for everyone that wants to come, learn more about Pennie, learn about what is coming. And again, Scott, Director Sherman, and I, we are here to try to help in any way we can. We thank you again to the public health management corporations. And before we close, I think if anyone has any questions, we'll be more than happy to answer them.
Hi, my name is Lan. I am a operations manager for a mental health nonprofit within PHMC. I do have two questions. So my first is, can you go over again what your relationship is with individuals who have Medicaid? So to confirm, you guys are a marketplace that is in addition to the other government assistance programs such as CHIP, Medicaid, etc., correct? And then also, is there a way for you to add additional languages onto your website? I know that some of the languages that you did note is prevalent within Philadelphia, but there are others that I can think of, such as like Vietnamese. And I've seen that within the Department of Public Health that they have been able to disseminate information in Vietnamese.
So thanks for those questions. First, I'll take them in the order that they came in. Confirming, yes, that we are an entity in addition to the Department of Human Services that administers medical assistance and CHIP. What happens for someone who applies for coverage through Pennie and is eligible for those programs is that they'll go through the process and get to a point where, based on the information they give us, it seems like their household, or at least some members, are eligible for medical assistance or CHIP. We'll inform them of that. On the back end, we transfer that application information over to DHS and share with them how they can complete the process. If all of the information they give us is enough for a determination to be made over at DHS, then that's run automatically. If more information is needed, then DHS requests more information from those individuals. And kind of the same thing happens in reverse if somebody applies for coverage through DHS and is sent over to us because they're eligible for our program. To your question about language accessibility, we know we need to be more accessible in more languages, so we are looking to do that. You know, part of the reason, a major driver of why we were only available in a couple languages in our first open enrollment period primarily had to do with you know, the amount of time we had to implement the transition and implement a new program. So we're always looking to be more accessible and think that, of course, language barriers are in themselves a barrier to access to coverage.
Okay, thank you.
I can jump in next if that's okay. My name is Stephanie Schell. I'm the Executive Director of Pennsylvania Public Health the Pennsylvania Public Health Association, and also Senior Director of Strategy Development for PHMC. So first of all, thank you so much for being here today. And I do have a question. I hope it's not too much insider baseball oriented, but we did notice when CMS released their RFP, their expansion funding opportunity earlier this week for healthcare navigators, that Pennsylvania was not on the list of eligible states. Is that because you all are assuming full responsibility for navigation services across the Commonwealth, or will there still be other entities providing those services? Thank you.
That's a great question. Yes, short answer, yes. Longer answer is funding for navigator services, assister services from the federal government is restricted to states that use healthcare.gov. So as soon as we transitioned over to a state-based marketplace, we took over the responsibility of administering an assister navigator network as well as funding it. So we do, last year we did have a funding opportunity related to assister navigator services that was awarded to Cognosante in partnership with PAC, as well as Latino Connections. So assister services are through those networks. We are, we've been through one open enrollment period with that assister entity structure, and are currently evaluating the potential need to broaden it. So there may be additional funding opportunities down the road, but the federal government, obviously we all know, transitioned from President Trump to President Biden, and this administration has been looking to expand services and access, and has put more funding, seemingly more funding, into the assister program. So I think that's why that announcement just came out. That's a recognition of their desire to build back that network. So kind of on different timelines, but so that was the longer version. The shorter version is we administer it and we fund it as well. Was there two questions? I'm sorry. Or was that?
No, you answered, and thank you. That was incredibly helpful. I appreciate it.
Yep.
I've got a question. I was wondering what some of your marketing strategies are for reaching uninsured Pennsylvanians, because I imagine, like, if you're trying to reach a population without internet access or kind of more isolated rural populations, that would make communicating about Pennie really difficult. Are there any communication methods you found to be really helpful?
Yeah, I mean, I think our approach to marketing, just like any other entity that markets things, kind of took a left turn with the pandemic this past year. So we were pretty, I think something that we did that was unique to this year is we de-emphasized out-of-home marketing. So billboards, bus signs, and kind of redirected a lot of that resource into more digital focused advertising. But I think, we had a pretty traditional approach of TV, radio, both digital and traditional, a whole lot of digital through various different measures, and then, more community-based sponsorships and different types of focused advertising and messaging. I think we probably didn't emphasize enough in non-traditional type advertising, and I think something that we've looked at ramping up as part of this special enrollment period that we're doing right now, specific to the pandemic, is going into less traditional media type organizations. So I don't know, Juan, if you want to speak to that a little bit more, but
Yeah, Director Sherman, thank you for the opportunity. Reaching out is different communities and underserved communities is a challenge for everyone. We are connecting in outreach with different media, minority-owned companies. Just to give you a few examples, TCP Network, an African American digital agency here in Lancaster County. We partner with La Voz, La Voz Latina in Harrisburg. It's a newspaper that reaches out the Hispanic community. And we're trying to continue building up our relationships with the community organizations. And I invite you as well, because this is outreach. Literally, there's a lot of work to do. Lan, you just mentioned the Vietnamese community. We would love to be way more connected with the Vietnamese community, and we thank you if you bring us the opportunity to learn more and connect with them, with even the media agencies, the newspapers, the radio. If there is any other way that we can connect, any community organization, if in the future there are opportunities that perhaps we can consider a sponsorship, that we can be there in any way, in any presence. There's a lot to be done. And I think that that's part of what we recognize as a company, that we are going to be better soon, literally. And we are open, and we are open for suggestions and to work with the community. We are humble in learning more about ways that we can improve.
Thanks. Are there any other questions from the group? I actually have one more question that I'm pretty curious about. What do you guys think are the benefits and drawbacks of a competitive insurance marketplace when compared to a single payer system like the Sanders Medicare for All Act?
Well, that's an interesting question. I would say, I think I guess what I have to offer on this is that, we are largely responsible for administering and implementing the program based on the laws that we're currently under. I would say their whole scale transformation and change associated with moving towards a single payer system. There's probably positives and negatives associated with it, but I would say, having been involved in the Affordable Care Act for a while and involved in kind of transforming just the individual market, which only represents 4 to 5% of the healthcare of the not United States population. Time and effort spent in change management, change transformation is very important. And that any sort of transformation such as one on that scale, putting aside all the politics of moving away from multi-payers to one payer, just would need time. So I can't, I'm not sure I can go into great detail on the merits and positives and negatives of our status quo versus a single payer system. But I would say transformation of that size needs time.
Awesome. I will wrap the meeting now, but of course the contact information is in the chat if you think of any other questions to ask. Pennie, thank you so much for this really informative presentation. To everyone here, next Thursday, we're going to have another lunch chat with some researchers from the Pennsylvania LGBTQ Health Needs Assessment. So if you like this, definitely check your inbox after the meeting for an announcement email about that. Yeah, thank you so much to the presenters for a great presentation.
Thank you very much.
Thanks so much for the opportunity.
Bye, everyone.